This mattress is called our First Step Cirrus. It is a 300-pound weight capacity and can be delivered as either a mattress replacement system or a mattress overlay. If it's going to be a mattress replacement system, just this top air portion, low air loss portion, is what is delivered, and it's placed on a customer's existing mattress. As a mattress replacement system, it will come with this 3-inch foam base in a 5-inch mattress. It is indicated for prevention and treatment of all stages of pressure injury. It is a low air loss product with a moisture vapor transfer rate of greater than 200 grams per meter squared. The average low air loss product on the market is about 80 grams per meter squared. As you can see, it's got a very, very high moisture vapor transfer rate, which enables it to take care of the temperature and humidity at the body surface interface, and that helps with decreasing friction as well as shear. This mattress does have a gore cover, so this replaces the need for having to use a cover sheet on top of this mattress, as is frequently used with most low air loss products. You can put a sheet directly on this mattress, and then you want to use dry flow pads. The size of the mattress are an anti-slip, so that when the patient's egressing out of the side of the bed, it's not as slippery as the internal surface, so it helps for stability. You can deflate the mattress for CPR, and that is done by reaching to the tube set, lifting the handle right here, lifting up, and that will rapidly deflate the mattress. To put it back on, it's just a matter of putting it back in, and the mattress will inflate again. The First Step Cirrus uses the First Step Select pump that's also used for the regular First Step Select mattress, or the First Step All-in-One. The on-off button is this green button, and you're going to press, and the mattress will turn on. To inflate it rapidly, you can then press Instaflate. So when Instaflate is on, when it's completed, it will actually turn itself off after 15 minutes if you forget to turn it off. Instaflate is used for ease of moving a patient up in the bed, lateral transfers, or boosting. When I'm done with the Instaflate, so I'm going to turn it off, and it will go back to the previous settings. There is also a seat deflate. If I want to assist the patient in having the seat deflated for bedpan placement, or to get their feet a couple inches to the ground, I can do seat deflate. When it's in seat deflate, it will actually blink seat deflate, but all the air will come out of the seat section, and that itself will turn itself off in 15 minutes, but I'm going to turn it off myself. This pressure can be adjusted both manually or for the factory settings for the weight. We do recommend that you use the factory pre-settings, and that is done here by pressing the pressure adjustment. And the pressure adjustment, then you're going to adjust the height and the weight, or I can do it manually. In this case, I'm going to use the height and weight. I'm going to press this arrow underneath the height and weight. This allows me to set the height in increments of from 2 feet up to 6 foot 8 inches. And right now it's set for a patient who weighs 5 foot 7 inches. I can decrease it by just pressing the decrease button, or I can increase the patient's height by pressing the button here. Once I enter the patient's height, right now 5 foot 7, I press enter. Then it allows me to enter the patient's weight, anywhere from 50 pounds up to 300 pounds. We'll say this patient weighs 175 pounds. 175 pounds, I will then press enter, and then I will then exit the mode, and it will adjust the pressures in all 3 of the sections to the preset factory settings. Once again, we do recommend that. However, you can also do manual setting, which would be then press the pressure adjust, push the manual button, and then I can do the head section, adjusting it, the body section, and then the leg section individually, and exit back out of that mode. You also have a warmer. Now this warmer is not a therapeutic warmer as far as like a bear hugger or anything like that goes, but it is for patient comfort. If you press the warmer, you can then, tells you to press the arrow this way in order to turn it on. So I will press this arrow up, and right now the warmer is on low. I can put it to medium, and I can put it all the way to high. Once again, this is for comfort only. I can then pull out of that system. If I want to turn the warmer off, I would then put warmer adjust once again and take the arrows all the way down until the warmer is off, and it's telling you to press this arrow to turn off that the warmer is now off. So switch out of that. That is basically your First Step pump.